From KETK News, you're watching East Texas Live.
Well, welcome on back to East Texas Live on KETK, and joining us right now is Dr. Ashley Norrie with Oak Street Health with advice on how to keep our seniors healthy. Good morning, Ashley.
Good morning. Thanks for having me. I'm excited to be here.
I'm excited to have you here, and so there's a lot to unpack right now. First and foremost, I just kind of want to have you tell us about Oak Street Health.
Absolutely. So Oak Street Health is a network of primary care clinics that takes care of adults on Medicare. And we focus a lot on preventative medicine and really comprehensive care. So we think a lot about our patients' physical health, but also their emotional health, their mental health, and their social well-being.
So talk to me a little bit about the patient experience. You know, if there is anybody here in East Texas that is thinking of getting on board, what can they expect?
Absolutely. So I think Oak Street looks a little bit different than your typical primary care office. So we're a value-based care organization, and we have a really big care team that helps to take care of our older adults. So for example, there's fantastic doctors, nurse practitioners, and physician's assistants, but we also have medical assistants, nurses, social workers, behavioral health specialists that all come together to think about what's best for our patients. And because we're value-based care, we get to invest in a couple of extra things, like transportation to and from the clinic if patients need it, and medical scribes that type the notes for the doctors so that they can spend more time having a conversation with their patients, rather than turning their back to patients and typing on the computer.
So East Texans will be in very good hands.
Absolutely.
So I know we're kind of reaching the light at the end of the tunnel, slowly but surely, when it comes to COVID-19, but it is still something that we need to be conscientious of. We need to think about, you know, what should older adults keep in mind when it comes to COVID-19? What's safe, what's unsafe? Can you kind of talk to me about that?
Absolutely, and it's such a great question. I know the past 18 months have been really challenging for a lot of people, and a lot of people are thinking about what's safe now and what's not. And I think the best guidance still comes from the CDC, thinking about those things like hand washing and social distancing, wearing a mask if you haven't been vaccinated out in public. I think that those are really good guidelines for people. But at the same time, we also want to encourage people, especially those who've been vaccinated, to come out and socialize, because that can be so important for a person's health.
Certainly. And you know, we're kind of reaching the end of July. It's crazy how fast this month has gone. But August, and on that note, is immunization month. And so what should people keep in mind? Is there anything that you guys are doing for this?
Absolutely. So, of course, I have to mention the COVID vaccine.
Yes.
Still the #1 thing that we have to protect against serious illness and death from COVID. But given that it's immunization month, we can also talk about the flu shot in fall, pneumonia shot, shingle shot, tetanus shot. There's lots of different immunizations that people need to be aware of. The most important thing, I think, is that a person's health care is really individualized. And I really encourage all of our older adults in East Texas to talk to their primary care doctor about what's right for them.
Now, Ashley, is there anything that East Texans can do specifically to just make sure they maintain a fit and healthy lifestyle right now?
Yeah, my favorite question is a primary care doctor. So I know that East Texas has a ton of great hiking trails.
Yes, we do.
And I think a #1 thing that adults can do to stay healthy is stay active. Of course, also be aware of, you know, things that you eat, everything in moderation. And then make sure to see your primary care doctor and talk to them about preventative health screenings like mammograms, colonoscopies, things like diabetes checks. People can sometimes feel great and not know that they have a couple of things going on. So it's important to see the doctor on a regular basis. And if your doctor, you know, if you want a second opinion, you can come by Oak Street, or if it's been a long time since you've seen the doctor, come see us too, because we're happy to give that individualized, personalized care to all of East Texas.
Well, Doctor, thank you very much. You have such incredible advice for us here that we can apply, so thank you.
Absolutely. Thanks again for having me.
Of course. All right, y'all. Coming up next, we will be right back with the second half hour of East Texas Live in just a couple of minutes. Stay with us.